blood supply of the brain stem. We should focus only few of the arteries. One is the anterior spinal artery. The other one is posterior inferior cerebellar artery. The third one, anterior inferior cerebellar artery. And the fourth one is basilar artery. Mainly the questions are asked based on any of these four arteries getting affected. So if we look at these things, say this is the brainstem part starting from, because below that there is a spinal cord, right? So if we look at this thing, this anterior spinal artery, this one, anterior spinal artery, and the posterior inferior cerebellar artery. This is mainly the medulla part, right? The lowermost part of the brainstem is the medulla. And even in this medulla, if we look at this one, anterior spinal artery, this is involving mainly the medial aspect. So if there is a lesion in the anterior spinal artery, there will be medial medulla getting affected. Or if there is lesion within the posterior inferior cerebellar artery, this is the lateral aspect of the medulla. So lateral medullary syndrome in posterior inferior cerebellar artery, and medial medullary syndrome we will get in anterior spinal artery. We will talk about this thing in detail in the coming slides, but to understand like why anterior spinal artery is medial medullary syndrome and posterior inferior cerebellar artery is the lateral medullary syndrome. Now above that there is pons, right? So mainly if this anterior inferior cerebellar artery, it is supplying, this part is pons, right? Say I'll change the color. This is pons. This entire thing is the pons. This Pontine artery, it supplies mainly the medial aspect of the pons, and this lateral aspect of the pons is supplied by anterior inferior cerebellar. So anterior inferior cerebellar artery lesion will result into lateral Pontine syndrome. Okay. Similarly, the posterior inferior cerebellar artery lesion will result into lateral medullary syndrome, because they are mainly supplying the lateral aspect, and anterior spinal artery will result into lesion in the anterior spinal artery, medial medullary syndrome. These three things, they are very important, and most of the questions, they are based around these three things: anterior inferior cerebellar artery, lateral pontine; posterior inferior cerebellar artery, lateral medullary syndrome; anterior spinal artery, medial medullary syndrome. Now we will discuss about the symptoms, which collection of the symptom is known as lateral medullary syndrome or the medial medullary syndrome in the coming slide. Okay. So in the posterior circulation, first we will talk about the anterior spinal artery. And if we can recall where the anterior spinal artery, it mainly supplies the medial aspect of the medulla, lowermost part of the brainstem. So that's why the lesion within the anterior spinal artery will result into medial medullary syndrome. Now, within the medial medulla, what all the tracts are crossing that medial medulla so that they will get affected? One of them is corticospinal tract. The other one is medial lemniscus. The third one is in the caudal medulla, cranial nerve, 12 nuclei. So there will be symptoms which affect the corticospinal tract. Corticospinal tract, it means there will be paralysis, and there will be opposite side, contralateral paralysis of upper limb as well as the lower limb because of the entire half of the body, right? Medial lemniscus. What is the medial lemniscus? It is just, say, the posterior column ascending pathway, like the spinothalamic tract, posterior column or dorsal column, when they cross over in the medulla and move to the opposite side, then they traverse along the medial aspect, that is the medial lemniscus. So it means there will be loss of the sensation which are carried via the dorsal column from the opposite side of the body because they have crossed over. And dorsal column, if we can remember our physiology part, this dorsal column or the posterior column tract, ascending tract, they carry the sensation of proprioception, joint position, vibration. So the patient will have reduced proprioception, joint position or vibration from the opposite side of the body. And the third thing is cranial nerve 12th, hypoglossal nerve getting involved. So ipsilateral, same side, tongue will get deviated. So the person who suffers from the anterior spinal artery lesion will affect the medial medulla, which is known as medial medullary syndrome, and this is the triad of medial medullary syndrome. What are those triads? The triads are contralateral, half of the body getting paralyzed, contralateral, dorsal column, sensation lost, proprioception, joint position, vibration sensation lost, and ipsilaterally, tongue will be deviated like this side, paralysis as well as loss of position sense, joint position sense, and vibration, and tongue is getting deviated toward the site of the lesion. That is the medial medullary syndrome. It is caused by the infarct of paramedian branches of the anterior spinal artery. Some of the cases might have vertebral artery. Okay. Now coming to the second most important one, the posterior inferior cerebellar artery. Now the posterior inferior cerebellar artery, it was supplying the medulla, which affects the lateral aspect of the medulla. So that's why it is known as lateral medullary syndrome, or it is also given the other name, that is the Wallenberg syndrome. The mnemonic for this one is PICA, PICA. So don't pick don't pick a horse that can't eat. So can't eat is dysphagia. Horse is hoarseness of the voice. Pick and means pica, for the pica. So if there is a lesion in the pica, there will be hoarseness, there will be dysphagia. If we can recall back, anterior inferior cerebellar artery, sorry, not the anterior inferior, the anterior spinal artery, the anterior spinal artery, which was resulting into medial medullary syndrome. Which cranial nerve was there? 12th. Now above the 12th, 9th, 10th, and 11th, they are located in the lateral aspect of the medulla. So they will get affected. When this 9th, 10th, and 11th cranial nerve is getting affected, there will be hoarseness, dysphagia, right? Hoarseness will be there, dysphagia will be there, there will be reduced gag reflex will be there because of the involvement of 9th, 10th, and 11th. There will be vomiting, vertigo, and nystagmus that patient might have these features because the vestibular nucleus is getting affected. Vestibular nucleus. Now, what about the sensory loss? Lateral spinothalamic tract. Lateral spinothalamic tract is getting affected, and lateral spinothalamic tract is the one which carries the sensation of pain and temperature. So there will be loss of the pain and temperature of the contralateral body and ipsilateral face. Some of the sympathetic fiber, they might get affected of the same side, which will result into Horner syndrome. Horner syndrome is ptosis, meiosis, and anhydrosis of the same side, right? So these symptoms. So a person who presents to the emergency with dysphagia, hoarseness, reduced gag reflex, vomiting, vertigo, nystagmus, loss of pain and temperature in the contralateral aspect of the body, opposite side of the body, but on the same side of the face, and there is ptosis, meiosis, and anhydrosis on the same side of the face, right? Then you should suspect that that person is suffering from pica, posterior inferior cerebellar artery lesion, or lateral medullary syndrome, or Wallenberg syndrome. Okay, Wallenberg. Actually, I tried to memorize during my NEET PG exam days. Like say Wallenberg, W is upside down of the M, so it is medullary, and there is Wallen, double N, so lateral medullary. It might sound quite stupid, but that's how remembered it. Like Wallenberg is lateral medullary syndrome and pica. So in short, we can say pica, don't pick a horse who can't eat. So hoarseness, dysphagia, and immediately your mind can go like the hoarseness and dysphagia is 9th, 10th, and 11th cranial nerve. So there won't be any gag reflex too, right? What all other symptoms will be there? Corticospinal, lateral corticospinal tract. Lateral spinothalamic tract. So loss of pain and temperature in the contralateral body and ipsilateral face, right? So pica, hoarseness, dysphagia, contralateral body, and ipsilateral face, reduced pain and temperature, ipsilateral Horner syndrome, ipsilateral ataxian dysmetria. Why? Because this pica, the posterior inferior cerebellar artery, as the name itself suggests, posterior inferior cerebellar artery. It supplies blood to the inferior cerebellar peduncle. So if there is involvement of the cerebellum, whether that is a part of the peduncle or cerebellar cortex, there will be ataxia and dysmetria. So all the symptoms of these cerebellar involvement, Horner syndrome, hoarseness and dysphagia of 9th, 10th, and 11th, and because of involvement of anterolateral spinothalamic tract, loss of pain and temperature. Lateral medullary Wallenberg pica. Now, anterior inferior cerebellar artery. Anterior inferior cerebellar artery, it supplies blood to the lateral pons. That's why it's also known as lateral Pontine syndrome. So, lateral Pontine syndrome is happening in the lesion of anterior inferior cerebellar artery lesion. And if we can recall back, anterior spinal artery, which cranial nerve nuclei? 12th. Posterior inferior cerebellar artery, 9th, 10th, and 11th cranial nerve. Anterior inferior cerebellar artery, cranial nerve, 7th. So the symptoms will be as that of facial nerve involvement. So the other mnemonic is facial droop if ICA pooped. If a person's ICA is getting pooped, there will be the facial droop. Now, what will be the symptom in the facial droop? There will be the paralysis of face. Paralysis of face, right? And in the paralysis of the face, because the facial nucleus is getting affected, so there will be lower motor neuron lesion of the facial nerve involvement. And what are those? There will be reduced lacrimation, reduced salivation, reduced taste from anterior two-thirds of the tongue. Anterior two-thirds of the tongue. And the other symptoms will be same as that of, like say, posterior inferior cerebellar artery. There will be reduced pain and temperature of contralateral body and ipsilateral face, and there will be ipsilateral Horner syndrome, there will be ipsilateral ataxia. As in anterior spinal artery, cranial nerve 12th was getting involved, posterior inferior cerebellar artery, 9th, 10th, 11th, anterior inferior cerebellar artery, 7th. What about the 8th? The symptoms of the 8th will also be there in this one. And what are those symptoms which are present in this anterior inferior cerebellar artery lesion? Ipsilateral sensorineural deafness. So we can say now coming in conclusion, posterior circulation, anterior spinal artery lesion, posterior inferior cerebellar artery lesion, and anterior inferior cerebellar artery lesion. Okay. What was the anterior spinal artery lesion? It was supplying medial aspect of the medulla. So medial medullary syndrome. Posterior inferior cerebellar artery, lateral part of the medulla. So there is lateral medullary syndrome. And in the lateral medullary syndrome, what was the other name? M upside down, that is what? And lateral Wallenberg syndrome. Wallenberg syndrome. And in anterior inferior cerebellar artery, this is the lateral Pontine. Lateral Pontine. That's the name. ASA is medial medullary syndrome, MMS. Pica is lateral medullary syndrome or Wallenberg syndrome. Pica is lateral Pontine. What was the mnemonic for the pica? Don't pick a horse who can't eat. Hoarseness and dysphagia. So easily you should think about cranial nerve 9th, 10th, and 11th. So now we know about the pica, that is the lateral medullary, 9th, 10th, and 11th. Anterior spinal artery is 12th cranial nerve feature, and anterior inferior cerebellar artery is 7th and 8th. Right. Now, what were the symptoms in the anterior spinal artery lesion? There was contralateral paralysis, corticospinal tract involvement, contralateral paralysis of opposite side of the body, right? And what was the other thing? There was contralateral loss of joint position, vibration, right? And what was the third one? Tongue was deviated toward the site of the lesion. Tongue was deviated toward the site of the lesion. All these features, these three things, you should just focus on this. It is anterior spinal artery lesion. In pica, 9, 10th, and 11, there will be the dysphagia, hoarseness. What other symptom will be there? There will be loss of pain and temperature in contralateral body and ipsilateral face. In ICA, you just focus on the symptom which are regarding the facial nerve, right? Facial nerve involvement and this one, sensory neural deafness. So if in a question there might be say 7-8 sentences, but if you get hold of the facial nerve feature and this one eighth one, like there is some reduced salivation, lacrimation, anterior two-thirds of the tongue, and sensory neural deafness, just focus on anterior inferior cerebellar artery or lateral pontine. Now, one more artery, that is the basilar artery. If there is a lesion of the basilar artery, the person will suffer from locked-in syndrome. So the mnemonic for this one is locked in. The person who suffers from basilar artery lesion has been locked in the basement, right? Just imagine a person who has been locked in the basement. So what that person will do, that person will be looking upward for any kind of the help that's coming from the upper floor because he is locked in the basement membrane. So there will be loss of the horizontal eye movement, but presence of the vertical eye movement. Vertical movement of the eye will be there, and because it is locked in, that person is not able to move anything, so there will be the quadriplegia. So easier to remember is quadriplegia. Just imagine a person who is locked in the basement, not able to move any limb, whether it is the upper or the lower, quadriplegia, and looking upward for any kind of the help. So there will be vertical movement of the eye, but loss of horizontal eye movement. So that's the basilar artery. That's all. Thanks.